Hello, everyone. Thank you for joining us on this webinar today from Scholarship America on supporting students with disabilities or health challenges. My name is Meghan Hussey Lim. I'm the Associate Vice President of Institutional Partnerships here at Scholarship America. Just a quick accessibility note before we get started. Closed captioning is available for this webinar. If you go to the bottom of your Zoom screen and hit the three dots that say more, you will have an option to show captions. So please take advantage of that if you need that. And with that, I would like to turn it over to Dr. Lanius. We're very grateful for her and our generous sponsorship of the Lumina Foundation who are making this webinar possible today.
Thanks, Meghan, and greetings, everyone. I'm Katie Lanius, Strategy Officer for Student Success at Lumina Foundation, and it is really my honor to welcome you today to this webinar, Supporting Students with Disabilities and Health Challenges. At Lumina, we believe every person should have access to and the supports necessary to complete a credential of value beyond high school that leads to economic prosperity. But that vision means nothing if we're not honest about who gets left out. Students navigating chronic illness, disability, or complex health needs face barriers that often go far beyond tuition, and frankly, our field hasn't always been designed with these students in mind. This conversation is a step towards changing that. Today, you'll hear from 4 practitioners doing the real work on the ground. I'm joined by Andrew Holbrook, Chief Accessibility Officer at Wells Fargo, where he leads enterprise-wide efforts to embed accessibility and inclusion across products, services, and workplace practices. Tanya Fleming, Partnerships Development Manager at Epilepsy Wellness Advocates, where she's focused on expanding access to education and support for students and families navigating complex health needs. And Meghan Hussey Lim, Associate Vice President of Institutional Partnerships at Scholarship America, whose work centers on building strategic partnerships that expand access for historically underserved learners. And guiding our conversation today is Merrill Friedman, who leads public policy and issues management at Elevance Health, with a focus on health equity, disability inclusion, and partnerships that extend well beyond traditional healthcare settings. I know I'm excited for today's conversation, so Merrill, over to you.
Great. Thank you so much. And thanks everybody for joining us. I will make one correction to say I lead inclusive policy and advocacy at Elevance Health, part of that public policy and issues management team, but my boss might not be very happy if we spread the other rumor, but thanks for the promotion. Glad everybody is with us today. This should be a fun discussion. We were just going to talk among ourselves, answer a couple of questions, and have a great dialogue. So hopefully everybody will engage with us along that. And to my panelists, I'm super grateful to be here with you today. So I'm going to start with one of those great opening broad, right, questions that we all love at the beginning of a presentation of any sort, and talking about why this is so important, right? Why we personally do this work and why our organizations, right, are so committed to supporting students with disabilities, right, and other, students and young people with chronic health conditions, and how does it align across your broader work? So I'll give you a couple of seconds to think about it as I talk a little bit about, even the work I do here at Elevance Health and our commitment. And that's just that basic principle, right? That everyone should have the support and access to attain their goals. Education is certainly part of that. One of our goals across the, Elevance Health is to improve the whole health of the people that we have the privilege of serving. That includes social, physical, emotional health. And it means helping people to meet the goals that they set for themselves, right? Just being really person-centered. So within that, right, education, employment, engagement, goals are huge. So that, satisfaction that people get when they can support their goals and supporting people to improve their overall health and well-being, just, it's our sort of our pinnacle there. So hopefully that guides a little bit of this. And so Tanya, do you want to maybe give us a start there and then just ping pong it around, folks? Jump in.
Us at the Shore Foundation and Epilepsy Wellness Advocates, supporting, students with disabilities it's really core to our mission, and it's very personal. So, when you think about students with disabilities like epilepsy, you're talking about kids that are managing so much active seizures, medication, medical appointments, and all of that unpredictability. And then when you layer on that financial stress, these students are overcoming challenges I wouldn't have been able probably to at their age, when I was a kid. So that's who we want to show up for. Those are the students we want to step in for. Our whole philosophy really is, if we can just remove even part of that burden that these students are dealing with, we can really give them a shot at achieving something that they might have really written off because of a diagnosis.
Yeah, absolutely. Absolutely. Andrew?
Yeah, Tanya, I'm going to ping pong off of that. No, I thought that was great. Just, well said. For me, where all of this comes from is, yes, I am Chief Accessibility Officer at Wells Fargo. I've been in financial services for 20 years. Before that, I was a college professor. So I taught at the University of New Orleans right up to Hurricane Katrina. We can probably tell why I had a career change. But one of the things that was well instilled with me, just within being in higher education, is knowing the challenges that students encounter, just to have an affordable lifestyle in order to get the training, in order to provide this economy with the lifeblood that it needs. And so this is even a more challenging space for people with disabilities, where we may have additional costs that their peers and higher learning may not have. And so this is why every bit helps, if you will. And I'll just add to that is, like, jumping into the private sector. I've been in and out of the private sector most of my career. One of the things that I noticed is that, hey, where are my peeps? Where are the people that are like me? So for everybody's edification, I'm hard of hearing. I was born that way. I've been wearing hearing aids since time immemorial, and have spent a lot of my life in sort of with the disability community, and then getting into the workforce and seeing less representation sometimes is a noticeable delta from that community. And so I think that's what these programs are so impactful for, is scholarship programs. Financial services helps lower the barriers of entry for a community that wants to and can contribute excessively well to the growth of this great nation.
I agree. I agree with both of you wholeheartedly, and thank you for reminding me that I did not share. I do have ADHD, and it was a huge part, right, of the reason, of so much of the work that we do. But really getting behind that push forward to create those supports, right, and that access, and bringing that intentionality to it, is making sure that so many folks like us just have those same opportunities with reduced barriers. Megan.
Yeah, so I'll jump in. I have a family connection in terms of my personal commitment to this work. So my sister, who's not that much younger than me, is autistic and has intellectual disabilities. My mom's a career special ed teacher, so this is kind of the world I grew up in. But within that, the values that were always very deeply instilled in me is what my mother always used to tell us, which is that different is not less. So as we look at Scholarship America, our mission is to ensure that all students have the resources they need to overcome whatever financial barriers that might be standing in their way to achieving their post-secondary dreams, whatever they are. And we simply cannot achieve that mission if we leave behind the 21% of students that are reporting to have a disability. And we know right now there's a really stark persistence gap for these students. The latest statistics show that only 38% of students with disabilities complete a bachelor's degree in 8 years, compared to over 50% of their peers without disabilities. And that goes beyond the four-year bachelor's degree pathways. We know that also there are 17% of students with disabilities that go into vocational or technical schools, which is another thing that we're committed to supporting at Scholarship America. So we see this type of inclusive programming, both targeted scholarships for students with disabilities and then broader, making our scholarship opportunities accessible to students with disabilities more generally, as being absolutely critical for us to achieve our mission to make sure that all students have this opportunity.
Thanks, Megan. Thanks all of you for sharing. I think it is the premise from which everything else will run. So we've talked about the barriers in our kind of our comments about our commitment and our why. But what are some of those less visible barriers, right? We know, building accessibility can always be a barrier. The financial, sometimes more visible than others, right? But to help, right, students with disabilities and chronic health conditions through this process, right, we start with those not so visible barriers like stigma, right? Isolation, not presuming competence, even sometimes it's missed days at school, right, due to other health appointments or how you're feeling. So who wants to kick off here? Andrew, do you want to start us on these less visible barriers?
Yeah, I mean, I'll be happy to, but I'd ask other panelists to kick in, if you will. I think
we're all going to chime in. You can't get
yeah. I
rid of
mean, I think the one thing, and this is something which I read an article on this about a few weeks ago about the humble PDF and what it's doing in terms of backstops to advancements within all the artificial intelligence models. So yes, I'm the first one to say AI, so I get the gold star, right? Because every meeting I do AI comes up. But one of the things that's a backstop is scannability of PDFs. And so much educational material is out there on PDF. And it's a barrier to people who need screen readers in order to do it because they don't have access to the same information. So it's one of those things that people don't think about. And it's something that I don't have a solution, but by gum, this is one of those things that I'm hoping that AI can help unlock this, because it is a hidden barrier to people who are reliant upon screen readers and other things to unlock that information.
Great, thank you. Tanya, Megan?
I will tag along with what you said about stigma, which leads to isolation. That's a big one that we hear a lot about in the epilepsy space. Epilepsy is still very much, it's a hidden disability. And it's also still very, very stigmatized. So we hear from a lot of our kids that they just feel very alone. And that, through some of the programs that we support, we've had kids in their 20s say, I never met anybody else with epilepsy. And all of a sudden they feel like they have a place. As Andrew put it, they found their people, which is huge to moving forward when you feel like, oh my gosh, I belong somewhere. That's so powerful. And it's a piece of this that's really hidden, because I have a daughter who has epilepsy. She didn't tell anybody for a long time because she was like, nobody's going to want to be my friend, or people are going to judge me. So battling that stigma and in turn battling that isolation and loneliness, that's a big one.
I'll add on to that too, because I think the attitude barriers, in addition to the financial and technical and practical barriers, like Andrew brought up, are really big. One thing that we've been talking about at Scholarship America is helping people to understand and kind of redefine what we've traditionally thought of as the students that are scholarship material. And I think a lot of students with disabilities assume that they are not, or have absorbed societal prejudices that assume that they are not. So that's where I think having targeted scholarship programs, in addition to making more broad scholarship programs more accessible, are really extremely impactful for students with disabilities to be able to say, not only are we going to help you break down this financial barrier, and definitely that financial award is impactful and important, but then there's also something special about scholarship programs where it's the confidence boost of somebody saying, I see you and I believe in you and I'm investing in you and your potential, that I think is really important. And it's why conversations like this are really important, because it helps us to redefine that narrative about students with disabilities, and help them see themselves as scholarship material, because there are so many students that might not even go looking for scholarships. So they just assume it's not for them, or they won't put in an application because they just assume it's not for them, or their parents are assuming it's not for them. So that's why I think those barriers are also really important.
I love that. I think it goes along with, right, just low expectations, which is another one of those just, really not so visible barriers, but it's so visible, right, to people with disabilities. Any other thoughts on the non-visible barriers before we move on? Right. We can always fold them in, right? That's the good thing about it. We're not done yet. So when we look at those barriers, right, we've kind of teed up to some physical, right, more physical as in more visible barriers, as well as some of the less visible barriers that are painful, for so many people and really inhibiting. So if we look about inclusive support, like in designing that and kind of what comes next, how do scholarship programs, right, and the support, how can we design those better? Right. I always start with talk to people with disabilities, talk to students with disabilities, include us, do not design anything without us. Right. And so, right, if we start with that as the premise of where to move forth from, what thoughts do you all have on designing inclusive support?
I can
Meghan, do you want to kick us off maybe?
First and talk about some things we think about when we think about things at Scholarship America. So first I want to kind of piggyback of what Andrew was talking about in terms of technical accessibility. We're going through an upgrade on our platform right now, in our application platform. And one thing I'm really excited about is that we're working in partnership with Submittable, and they're really kind of best in class in terms of digital accessibility. Making sure that application is accessible and usable by students who might be utilizing different types of assistive technology or having those kind of digital accessibility pieces. That's very important. But then in terms of the scholarship design themselves, and this is something that our senior scholarship advisors at Scholarship America love working with different partners on, is thinking about how do you design in the eligibility criteria? So for example, many scholarships will say things like you have to be enrolled full-time. Well, that disadvantages a lot of students with disabilities who, for different health challenges, who need to pull down to part-time at some time. So thinking about, if we want to be accessible, can we also ensure that part-time students are also eligible? Thinking through the selection criteria. How heavily are you weighting different pieces, and giving students the ability to put in different, not only activities they're involved in, but different life circumstances, and giving students a ability within their application to bring their whole self, to be able to tell their whole story, and to take that into account when you're making those determinations as well, and having a scoring rubric that's really fair to students with disabilities as well. And then I would say, finally, thinking about what are the different ways that we could layer in potential different supports, whether that's adding on something like an emergency aid fund. So beyond the traditional scholarship, which tends to go for qualified educational expenses, if a student has a health emergency that they might not have the slack in the budget to kind of cover, or do we have ability within kind of the scholarship program for them to access those emergency funds when they need it? That's another thing that we could potentially do. So there's a lot of different levers we have to pull when designing, and it's always best to design inclusively from the start, rather than to design something and then try to kind of bolt on different exceptions or accommodations
100%.
for students with disabilities, it's best to kind of design with accessibility and inclusion in mind from the beginning.
Always, which is why it's important to include people with disabilities in that.
Exactly. Yeah.
Absolutely. Tanya?
Well, something that I had thought about when we got the list of questions was, talk to the people, because we kind of learned that the things we thought were, oh, these are going to be the barriers they're going to have to deal with. So let's, talk about that. Or these are the criteria we need to have. Once we really started talking more to not just people with epilepsy, but a lot of young people, the ones who are, typically going to be your college age kids, we realized what we thought were barriers were not the same barriers they were actually dealing with. So by taking the time to get that input from the students, it will reshape your entire scholarship program, but in a way that serves the population that you are trying to serve so much better. So make sure, as you said, Merrill, talk to the people who are actually living with this and don't just craft it from your outside view.
Yeah. I mean, because even, if you look at questions, right, that are posed on scholarship applications, if you put those in front of students with, disabilities, and like they'll tell you if those questions, right, how to reframe those questions so they can be better answered, right? I mean, it's just every step, right, in this process should be informed by people with disabilities.
Yeah.
Andrew.
Yeah, I mean, I love this, and I think if I were to sort of encapsulate what I think is important is really, it's not just about the shift left of designing, that you were just talking about, Megan, like being upfront, invest in the time early. It's also be intentional on what the outcome is that you want, and I think that that's an important thing, which I think, a lot of the financial support that might be there for students doesn't necessarily have an end goal. But I'm going to steal. So I encourage all of us to think about this the way that Tony Coelho, the co-author of the ADA, thinks about it, which he says, look, the reason for the ADA was paychecks, not pity. It was about getting gainful employment for people who want and can contribute. And this is all about removing those barriers. And so as we think about these programs, it's not just about the education, but also, well, what's the transition like? How does this facilitate greater internship or a greater probability of getting hired? That's something which I know I aspire to. I wish that I could say that I've got a ton of success stories in those, but it's definitely that's the mantra that that Tony kind of pounded into my head, and it's one thing that I love sharing with everybody else.
No, I totally appreciate those words from Tony and many others who, share that sentiment, of course. But yes, and it's also, seeing people, right, that with disabilities, succeed and being in these positions, right? I mean, and it creates that, like, yes, I can. People are telling me I can do it. I see you doing it. I can do it, and getting us, to that as well. But having those goals, right, sort of not laid out, but in front of you, right? We can see it. And it's that intentionality is such a huge part of this. We've all mentioned it in different places, but I think at the helm of what we're doing, we do have to be intentional.
If I could add
Right.
one other thing on in terms of intentionality and kind of going back to what we were saying about attitude barriers, I think it's also being really intentional about how the scholarship opportunity is promoted and marketed. Just because there's an opportunity out there doesn't mean students like psychically know that it's available, or even know to be looking for it, like we were saying. So I think being really intentional about reaching out to organizations like that are serving or advocating for different populations of students with disabilities, meeting students where they are, finding those different pathways in to encourage students to apply, and helping them to get over whatever attitude barriers they might have internalized is really important. Just because you create a opportunity doesn't mean that the applications will automatically come. I think we have to be really intentional about going out and finding those students also.
Yeah, we have to get it. We have to get the information to people, right? We have to get the information to people with disabilities and to people in their support networks, right? So that everybody kind of is, keeping an eye out for it. Okay. So then we start to look, right? What is beyond the scholarship, right? Life, right? Living your dreams, but all the other supports that come into mind, right? We've mentioned some of these a lot, right, around flexibility, but we haven't really dug into maybe some accommodations and, other, supports in their emergency assistance, right? I always think from a healthcare perspective, from the greater healthcare perspective, even things like, if people with disabilities are constantly being pulled out of school to go to, health appointments and take you over here. Well, can we do those in the evening? Can we do those on the weekend, right? Can we really help make that school, and that, integration and the successes that stem from there, a little less disrupted, right, by external forces? What are other ways and other supports, other things you can do that we can think of that would help redesign this? Universal design. Anybody want
Thank
to,
you.
jump
Yeah.
in?
Yeah. I mean, Meryl, you knew I was going to jump in with that,
Mhm.
which is, principles of universal design or something which, we're pretty proud here at Wells Fargo, one, to have been the place that Stacey Park Milburn chose to work. Uh,
Right.
Stacey Park Milburn, who was just recently recognized by the U.S. Mint as part of the U.S. Mint's Quarters program,
It's very
and
cool.
it's very cool. And when that became public, we worked with Scholarship America to rename the Wells Fargo Scholarship to the Wells Fargo Stacey Milburn Scholarship for students with disabilities, and we're real excited about that. And but one of the things that uh, with the Mint announcement, we were also allowed to share is that for the last couple of years, we've been working with our branch design teams to make sure that inclusive design is built into the physical spaces as we're planning. And so our branches we're rolling out new branch designs that are more accessible than ever. And it's pretty funny the kinds of things that make things accessible people don't think about. And I'll just give you the one example, which is go to a bank, you go to any place where you need to use a pin pad. If you bolt the pin pad to something, some people in wheelchairs can't reach up to it and put in their secret codes. So you got to put a little cord on it and unbolt it. I highlight that to say that most of these things cost us nothing. It's the intentionality that Meghan talked about and Tanya talked about, and knowing what the design state is and doing those things. So I mean, those are examples that I know I've been able to factor into my workplace, but it's also things that I'm sure that Tanya and Meghan could probably point to others where there's like places where it's like, this is how it manifests in the real world.
Yeah. Please do. I love that you brought up Stacey and that scholarship. I'll just, chime in for a minute. We have a Lex Frieden scholarship here that I brought about, um, a long time ago. I think I was gray still then, but it was way back. The days in Lex Frieden is one of the architects of the Americans with Disabilities Act as well. He and Tony have worked together, for years on access. And I think it is having those opportunities and for young people to be meeting people like Tony and Stacey, right? And Lex and so many others. We shouldn't start naming people because then we'll feel bad, right? Who are just really huge, groundbreaking, advocates that have changed, right? Everything from, curb cuts, all the work that's done by Adapt and Nickel and everybody else, right? Who are creating this change as well. But we do know how much more, right, needs to be done. A conversation we have every July at the anniversary of the ADA of how much more has to be done. So I love that you teed that up, Andrew. So now, Tanya, Meghan, over to you on that design, which is where Andrew was going, and the intentionality.
Want to go first? Or... I can jump in and say there's things that like a scholarship program can do, and then I think there are also things that scholarship programs like this can help be a catalyst for the entire post-secondary higher ed space to do. So one thing that I think we can model to Andrew's point, there are so many things, and like when you get down into universal design and things like digital accessibility. Thank you, Andrew, for bringing up the PDF issue. My mentee has a rare genetic syndrome that causes retina pigmentosa, and when I first started working with him, PDFs were like our kryptonite. So that's huge. But then when you get into things, it's like the ability to save applications and not do them all in one sitting, or be timed out if maybe you take a little bit longer typing, or you're using assistive technologies. There's things like we did a brand refresh a few years ago. Part of that is because there's certain color things that a lot of people do not think about when they're thinking about accessibility. And then when you really start delving into, there are all these things that I think if you're not being intentional, that people just miss. So I think there's certain things that we can model. There's also something about having scholarships in terms of bringing together either cohorts if there are multiple winners. So being able to connect students with others at their institution or at other institutions who are like them, which is really special, and alumni, and having that access, like a lot of people do in other fields, to previous scholarship winners, and being able to pay it forward and pass down lessons learned, or have that more experienced person to go to of how did you navigate this on campus, or do you have other tips as I'm trying to navigate the institutional bureaucracy of student disability services, that I think is really important. And then I think having that group of advocates can help, because there are some things that scholarship programs can do in terms of connecting people, or providing information for recipients on things like student disability services. But then there are things we're going to need to rely on the institutions themselves to do, in terms of improving things like universal design, or even in course design, universal design for learning, and helping students kind of navigate on that. So in that, it's really kind of a partnership between what scholarship programs are able to do, and then things I think the broader post-secondary higher ed landscape needs to do to make the whole system more accessible for students with disabilities and health challenges.
Yeah, thank you.
You really kind of touched on what I was going to bring in there too. So part of our scholarship design is we work with an organization called Young Adults with Epilepsy, and they have created an entire support group program for our scholarship kids. When you get the scholarship, you get a link to this support group, and our goal with it is to build that, not only that support group in the moment, but to keep building onto those mentors. You know, eventually this age group is going to graduate, and this group is going to be coming in, and they'll all have connected. And, you know, just like when you're in a fraternity and you can say, oh, you know, I know so-and-so over in this field, you know, we can connect you there. Our hope is to build that inside the epilepsy community with these young people. So we've kind of built that into our scholarship programs to provide that.
So I'm going to ping right off of that, as everybody's been leading up to this. And when you look at this level of intentionality, right, that we're bringing to the forefront here, is there, and every time anybody asks me this question, I'm like, yes, I have a zillion. I'd love to have a, right. But is there an outcome or a story or a time when you were supporting somebody that, right, brings about that real world impact? Like I think of a young person that we were supporting who wanted to go to, with, you know, multiple disabilities, but wanted to go to school out of state. And there's a portability issue, right, for some of your health support, right? Particularly if you're accessing your healthcare through Medicaid, that shouldn't be a barrier, right? We want, you know, people to be able to choose those educational opportunities that best meet their needs and their goals, and looking at ways we can do that. We were able to help them, right? But you know, those are the types of experiences that guide, right, our stick-to-itiveness with this type of work. So I'd love if each of you would share, you know, at least one experience that brings this to life for some of the folks who have joined us here today. Don't be
Okay,
shy.
I'll go first. Okay, so I'm going to steal one from. So I failed to mention at the beginning. The other reason why I'm passionate about the space is my parents taught children, autistic children, for 30 plus years, and and if you think about, like, you could probably tell by the gray hair that that wasn't just last year, if you will. So they were doing it at a time when these programs were still sort of in their infancy in terms of understanding the power of neurodiverse individuals and their and what they can add to the workforce that had been untapped largely. And so one of their students, I famously have called out, was somebody that had cerebral palsy, uh, autism, also some other challenges, if you will, physical challenges and medical challenges. And they had 8 siblings, but they were the first one to own a home. And the reason why is because there were programs that existed, one, to help with vocational training for this person to get the job a bit faster than any of their non-disabled brothers and sisters were able to get. And then there were also programs to help from mortgage assistance and these sorts of things. So but it didn't take a whole lot of money, and it didn't take a whole lot of support to do those things. It was just that incremental bit when the expectation was nothing. The expectation is no support. All it takes is a little bit to push them over. And so, and I famously say that that man, Pete, he's my age, and Pete gives me a hard time every time. He's like, because he knows I'm a renter. He's like, Andrew, how much is your mortgage? And I said, Pete, I don't have a mortgage. I pay rent. He's like, you work at a bank, right? Meaning that he knows that a mortgage is a better bet than a rent. And yet, here I am, Mr. Banker, can't figure this one out. A little bit of help, he became a homeowner. And I think that's just a great success story and something that I like to call forth. So that's an example I throw out there.
Love it. Love it. Thank you. Oh, the old debate of renting versus owning, right? Tanya?
So, there's one that I kind of like to go to a lot. We have a young man who is one of our scholarship recipients. Actually, not a young man. He was in his mid to late 20s, but still young to me.
There's that.
And he was coming down to his very last semester of school. He'd received a scholarship. However, he was not very much short. And we're talking like $500, I think it came out to, from being able to pay the final piece of what he needed to graduate that year. And thankfully, because we had an emergency fund set aside for those students, and we were able to, our emergency fund moves quickly. Instead of, sometimes there's emergency funds, but they drag out so long that they almost become useless. By building ours in a way that it was able to move very quickly, he was able to get the money and finish. He has now got his degree. He's very successful. He runs his own business. And he is just the most incredible young man. He's got a family that, now he's able to provide a life for that he didn't really think he was ever going to be able to give his family. So just knowing that because we were able to move that so quickly, I got to watch this guy succeed, and he's so impressive.
Yep. That's awesome. That's awesome. Thank you. Megan?
Sure. So I'll share a story that I came across at Scholarship America, one of our Dream Award winners, who was adopted from China, was then, after arriving, diagnosed with epilepsy and ADHD, and went through a lot of challenges at school, being told by a principal that she didn't belong in public school, being bullied, having those multiple compounding marginalized identities, being a minority, trying to find your place, and going through health challenges, to applying for one of our Dream Awards because of family circumstances that meant that she would need help paying for college. Getting that and then reading the quotes that because of this award, she was actually able to focus on her coursework and not be worried about financial barriers coming up, and having that open up a world of opportunities for her, and actually then taking her personal experiences, majoring in biological anthropology and pursuing passions in medicine, and really then being able to pay it forward in terms of wanting to work with marginalized communities in terms of different health issues. But having that scholarship, being able to be that thing that helps take some of that financial stress, and then also have that validation, having gone through so many challenges earlier in her life, to be able to take that next step into a future that looks more promising.
Love that. Thank you. And everybody, right, should be able to define what promising looks, like to them, and get that support to get there. So looking right at how we now support that, right, for all students with disabilities who choose to go this route. Hopefully new funders, new organizations are gonna, come to the table, right, wanting to create scholarships, wanting to create employment opportunities, wanting to help, right, with that bridge and those next steps. So if they're new, right, to supporting, students with disabilities and other chronic health conditions, what tidbits of learnings, and advice do you want to share and help people, right? I always love that equitable, foundation, that playing field, that many companies and funders will be doing this and we'll all have the same knowledge, right? So that access really just doubles and triples. So who wants to kick us off a little bit? I know, Tanya, you at one point were talking about assistance wraparound. Andrew talked about step employment. There's so many great ideas. So without putting you all on the spot, I'm going to put you on the spot and say, who wants to go first on this one?
I would say when we're talking to somebody who's designing a new scholarship program, build in that wraparound support from the get-go. Don't treat it as a bolt-on add-on later. Put that in there from the get-go, because you're going to find that there's a lot of value in having that as part of your program from the beginning. We have students in trades who wouldn't even be able to get into the program if there weren't for some wraparound funding to cover their PPE first. So, build that in from the get-go. Don't wait till like you've started and go, oops, we need this.
No, I think that is great. And you probably would have that information when you're talking to people, right, who have already done it like this, or talking to students with disabilities and their support, networks. Andrew, what thoughts do you have?
I mean, we highlighted it earlier, but I think it's really important to understand that supporting part-time and vocational education and other opportunities other than, sort of the traditional 4-year college, it's important to include that in the consideration set, because those pathways are pathways to financial success, globally speaking, but I think in particular for this community where there's been an a shortage of funding. And so it's where, the dollars have the maximal impact and create opportunities much more effectively than, some of the more traditional ways.
A little bit of flexibility goes a long way.
Yeah.
Right. Megan?
So I would say I would love to see what coming out of international development we used to call like a twin track approach when we talk about inclusion. So I think we need more targeted scholarships for students with disabilities, like the ones that have been highlighted here, because there's such a shortage of them, and we're dealing with a population that has some specific needs and has been traditionally underserved if we're going to get to a more equitable place. And I think those have a particular type of impact that's very important. But then I also, in addition to getting more funders for specific scholarships like that, I would love to see more and more kind of general or scholarship programs that are broader. Also be very intentional about designing to be inclusive of students with disabilities overall. And so incorporating that universal design that we've been talking about in things like eligibility criteria and things like application platform and different things to be able to really have a broader base of support for students with disabilities, including those that might have hidden or invisible disabilities as well. So I think if we're going to get to a place where all students have opportunities to succeed, we really do need both to be making progress at the same time.
Yeah, I love that. Because if you talk about making progress at the same time, right, the collective, if you look ahead, and we look at what opportunities exist for healthcare organizations, employers, philanthropic organizations to collaborate, so that we are more effective in supporting students. And there is that foundation, and we do lead with intentionality. What are those opportunities? What are a couple of thoughts that y'all have on ways that we can all come together to create opportunities going forward? And this isn't everyone, so I know I've called out each of you to start, but maybe I'll just go backwards at this point. Meghan, if you want to start on this, and I'll kind of go down the line. I think we started with Andrew and Tanya a few more times.
Sure. So I think there's opportunities for everyone here, and that's why I'm very privileged in my position at Scholarship America to work with a really wide variety of different scholarship partners and sponsors to work together. So I think more conversations like this are really needed, because I think all different types of organizations, whether it's healthcare organizations, philanthropy, really honored that Andrew's here, and that companies like Wells Fargo from the private sector are demonstrating how important this is, and kind of making the business case as well for investing in these students and this type of talent, which can really make a huge difference in our workforce. You said paychecks, not pity. So I think that all types of organizations, thinking through, it used to drive me crazy when some people would be like, we don't focus on disability. And it's like, well, you're reaching students, and some of those students are going to have disabilities. So I think everybody kind of taking it on and saying there's a role for all of us, regardless of what type of organization you're working for. Everybody has a role to play in opening up these opportunities and helping us to create a more accessible and inclusive future.
There is definitely a role for all of us. I know here at Elevance Health, we have scholarships, we have business resource groups, right? And we have one advancing disability inclusion, so that people with disabilities, everybody can be part of it. And lots of people who may or may not have disabilities are in there, but right, everybody thinking together and starting at the beginning for that. But I do think that companies that are intentional about creating access, inclusive spaces, right, flexible, schedules, all of those opportunities that create access. But when we come together to do that, in times like this and in other places, particularly starting young, right? If you think about, young people, in school, right? It's the community, right? So we have different communities as in different stages of life, but it does still take all of us to do this. Tanya, do you want to provide some thoughts on opportunities here?
Resource sharing and like, for me, it's all of us playing in the same sandbox. We tend to silo ourselves out and think, well, this is my space, and that's your space, and this is my space. But that doesn't help the students that we're talking about trying to help in any way. We all need to come together and realize that together we do more than if we each try to hold on to this little piece that we think is ours. And the other thing I would say is accommodations that are more than just a piece of paper. Accommodations that are actually put into play and that are being followed across the board. That's something we can all be part of making happen for these kids.
Yeah, I think accommodations across the life course, right? Whether it be school or work. I love that. We have a saying we use here, a lot, is that accommodations are not nice to haves.
Yeah.
Right. There are laws that uphold us, right? They create those, but it's really thinking through that. So I love that you brought up accommodations in this context as well. Andrew.
Yeah, I mean, I'm going to finish where I started. So I got to say AI first, so I'm going to end that way as well. I think this is one of the things that the workforce that exists today is going to be very different than the workforce that exists tomorrow.
Yeah.
And I think artificial intelligence education and really making it tactical is important for this community to leverage the skill sets that can equal the playing field in ways that have never been possible. And that's what I see in the promise, but also the risk associated with artificial intelligence, because a lot of the models were trained on data that we already know do not include all the information that we want them to include. So we got to do the hard work, the collaboration across enterprises, financial service companies, industry in general, education, governments, all these sorts of things. We're all in this together. And I think that, but it's a way of, of leveling the playing field and adding, growth to the economy that currently doesn't exist in a time when we crucially need it. And so that's where I see there's some great opportunities for collaboration. And that's what I would focus on.
Yeah, I agree with you. You did start and end, right? With AI, and I'll just say, I'll kind of start and end with the same thing I would say is be including people with disabilities in the development of AI, right? To ensure, right, that those disparities are eliminated at the time, right, of starting versus trying to, backtrack on AI, which I'd get over my skis on pretty quickly. So I think if reflecting a little bit, and if you want to take a moment to reflect as well before we wrap and hand this back over to our hosts, there is huge opportunity for us to support young people, right, and to support employment opportunities, right, education, secondary education, any education that some of us are lifelong learners. I know I learn things every day, a little different, but still learning things every day. But it will take, a continued focus, right, to create that access and those inclusive environments to do that. And it will take all of us coming together to do that in multiple organizations, multiple disciplines, and types of businesses, because people with disabilities, we all have a different interest, right? And want to get into different types of businesses. It shouldn't be tracked to do so. So we should hopefully be bringing on lots of other companies that will engage with Scholarship America and with others to create scholarships that are truly focused to create access and opportunity for people with disabilities and chronic conditions. And I think we can collectively come together to bring this about. So a lot of gratitude for the participants who joined us today and the panelists who joined us today, who are hopefully bringing their friends, colleagues, and others to think through this and bring it to their organizations and companies that they work with. But I'd love if each of you would just have some closing words as we wrap up and thoughts for the future. Andrew, I'll start with you. Going backwards again.
Okay. Closing words. If you're not using artificial intelligence right now, start it. You got to start training it today, because otherwise we're going to have the ChatGPT problem that for 7 months it said it had strawberry has 2 R's in the word, not 3. So all these challenges that we're going to be encountering, these are going to be the places where I think we tactically are going to get engaged. But what does that mean for all of us is that part of helping bring in a broader source of intelligence to the space makes us a better and stronger economy. And so that's what this work is all about for me. And so that's my last word.
Thank you. Tanya.
Goodness. So for me, it's just providing opportunity for students who have in the past been so overlooked, and removing those barriers, anything that keeps a student from staying focused, getting the education and finishing it should be something that we're all working to remove that barrier from those students.
Perfect. Thank you, Megan.
And I guess I'll end with one thank you for and co-panelists and to you, Mara, for your wonderful moderation and for this conversation today. For all of the attendees, regardless of where you are, if you're a student, a parent, or someone interested, please check out the Scholarship America website for more information on some of the scholarships that have been highlighted today. You can see all of the information about those awards and kind of how they've been designed. And I think that they can give some good inspiration on what some of these programs can look like, and also some great compelling stories. But if you are from another organization that would like to start a scholarship program for students with disabilities, or learn more about different ways that you can make your current scholarship program more accessible and inclusive of students with disabilities, please reach out to us at Scholarship America. We have a team that would love to work with you on doing some of that intentional design to increase these opportunities.
Excellent. Thank you. Access, opportunity. It is the future. So, and we are all there to support it. So thank you everyone so much. I hope everybody has a good rest of your day and week, and we appreciate all the work you're doing to either learn about, and to promote access and inclusion.